Namaste and G'day. Australia and India are celebrating today. January 26, Republic Day in India, Australia Day here in Australia. We share a wonderful friendship between the Australian and Indian peoples. We join with you in celebrating democracy today, India's and ours too, and celebrating the fantastic contribution of people with Indian heritage right here in Australia and all around the world. The journeys of our two nations have been very different, but we do share much in common, in particular, a common road ahead. We have a shared vision for an open and resilient and free Indo-Pacific region. We're partners across so many fronts, working together to secure that peace and freedom for our world and our region. I know the pandemic has tested so many of us, families separated, but now families are reuniting and students and travellers are returning to both our shores. So better times are indeed ahead. So on this Republic Day, I join our Indian friends and Australians with a connection to India in celebrating your Constitution's enactment on this day in 1950, as well as celebrating with you this year your 75th anniversary of independence. So, happy India Republic Day and happy Australia Day.
Namaskar. Dear listeners, today is the 26th January 2022. On behalf of the Indian Medical Association of Queensland, I welcome you all to the program Baatein Sehat Ki, which means a talk about health. Firstly, I would like to acknowledge the traditional owners of this land on which we gather and pay my respect to all the elders past, present and emerging. This program is being brought to you by Indian Medical Association from Brisbane in Queensland, Australia. The Indian Medical Association of Queensland is made up of doctors of Indian origin who call this Sunshine Coast, the Sunshine State of Queensland, our home. Today is a very special day as it happens to be the Republic Day of India and the Australia Day. India is celebrating 75 years of independence and all Indians over the world are joining together in celebrating Azadi Ka Anand Mahotsav. Now let me introduce to you our panelists who would be giving their advice on ever-changing scenario of the COVID. We have a small gathering of listeners here who can ask questions after the talk. Dr. Baatein Singh is an eminent cardiologist who is the founder president of our association. He is under his able guidance that we have over 1,000 members. We thank him for his organizing this program. We are honored to have Dr. Dilip Dhulipelia, the chairman of Indian Medical Association Foundation of Queensland. He is also the immediate past president of IMAQ Queensland. He was the first person of Indian origin to be the past president of 2 consecutive terms of IMAQ Queensland. Our keynote speaker today is Professor Neelam Maheshwari, Associate Professor of Pathology, Faculty of Medicine at Bond University, Gold Coast, Queensland. We also have amongst us Professor Alka Kothari. She is a senior gynecologist with Queensland Health and she will explain to us the relevance of COVID and the pregnancy. And lastly, let me introduce myself. I am Dr. Brajraj Pandey, Surgeon Lieutenant Commander, retired Indian Navy. I am the principal of the Aspley Family Medical and Dental Practice. I am fellow of the Royal College of Australian General Practitioners. I will be moderator today. May I request our past president, our President Baatein Singh, to please say a few words.
Today is a special day as we are celebrating Indian Republic Day as well as Australia Day. We're also celebrating 75 years of Indian independence. During these last 75 years, the Indians certainly have been through many triumphs, and the trials and tribulations have been largely overcome, especially the SARS COVID-2 pandemic over the last 2 years. This has also engulfed the entire world community. In India, we have overcome many disasters like earthquakes, famines, and the second peak of the Delta variant of this virus in May 2021, which caused untold harm and misery. At its peak, there were 450,000 infections every day, and these, with good management, came down to less than 20,000 over a few months. The world is now witnessing the third peak of infection related to the Omicron mutation of this virus. This certainly will be overcome as well. The Omicron variant is the most highly infectious of all the variants, but the illness certainly is not as severe in people who are vaccinated. However, it can cause significant morbidity and mortality, as we're now witnessing increased rates of hospitalization throughout Australia. This is particularly in people who are not vaccinated. I would therefore implore everyone to get vaccinated, as we now have a choice of 4 vaccines in this country, and also to get the booster dose if available. Without much further ado, I welcome you again and request Dr. Pandey to get the proceedings underway.
Thank you, Dr. Vagesh, for your word. May I now request Professor Neelam Maheshwari to explain to us and our audience about the COVID, the clear picture. Dr. Maheshwari, please.
Namaskar. I'm Neelam Maheshwari. I'm one of the pathologists working as a clinical microbiologist at Gold Coast University Hospital, and also associate professor at Bond Medical School, Gold Coast. I'm here to actually discuss and sort of give some update on the SARS-CoV-2, the pathogen which causes this pandemic and the disease COVID-19. I'm sure you all must be aware of the terminologies, but I think it might be just a good idea to just quickly go through them. So SARS-CoV-2 stands for Severe Acute Respiratory Syndrome, CO for corona virus, and it's type 2. So it means that we all were living with SARS-CoV-1, which had an outbreak especially around East Asia in 2002 to 2004. And now we have got this SARS-CoV-2, which causes the disease COVID, means coronavirus infectious disease 19, because it was discovered in 2019. Coronavirus has been living with us. It is believed to be evoluting, sort of circulating between the animals, and we believe that it has been jumping in between the animals and humans because of our close association with animals. The history backdates in 2019, when the first case was discovered in Wuhan around November, but it was declared by WHO around 30th of December 2019, possibly emerging from a wet animal market in Wuhan, China. When a surge of cases was noted, this was eventually declared as a public health emergency of importance, which was then declared as a pandemic in January 2020. The first case of COVID-19 came to Gold Coast on 28th of January 2020, which was nicely managed, as we were all very much prepared for this pandemic. So thanks to Queensland Health Government. Talking a bit about the SARS coronavirus 2. What is this virus and why does it mutate so much, to the extent now we have got its 7th variant, which is called as Omicron. So the initial virus was the Wuhan virus, and then we started giving Greek alphabets to them, alpha, beta, gamma, theta, and then certain Greek alphabets were omitted for certain reasons, and now we got Omicron. It seems that the Delta variant was quite dangerous and had lots of morbidity and mortality, and now we are to the mild version, Omicron. It is due to the mutations in the open reading frame, which is a part of the genome, which has the enzyme to multiply the virus, and the other part of the virus has the accessory structural proteins, which are used as antigens in the detection of the test, and the antibodies which are produced against these antigens help us to protect against this infection. There are mainly 2 types of main antigens: the spike protein, which is also called as the S protein, which is the receptor binding domain for this virus to attach to our human epithelial cells, mainly the respiratory epithelial cells in the throat, nose, upper respiratory tract and lower respiratory tract, and it also has affliction to attach to the endothelial cells, and that's why we see lot of implications on these organs, especially upper respiratory, lower respiratory tract infection, and at times heart diseases and abdominal problems like diarrhea, vomiting, fatigue, loss of smell and stuff like that. Coming to the diagnosis, I will leave this to GP. He will talk more about the diagnosis, but it can vary from mild to severe, and obviously to the most severe, where we can see mortality. But coming to the diagnosis, thanks to all the companies which have been very quick in giving out the, rolling out the kits for the diagnosis. We have 6 screening tests and confirmatory tests. The screening tests are example the RAT, the Rapid Antigen Detection Kit, and the saliva test, which is a lateral flow test, and the confirmatory test is usually the PCR and the tissue culture and the whole genome sequencing. So coming to the treatment, again it can be done in the community by the GP and the healthcare workers like nursing home, and it can be done at the hospital in the ED settings and at the COVID wards. With regards to vaccine, I would say we should go for vaccines because they form 2 types of antibodies, the anti-spike antibodies and the anti-nuclear antibodies, and they are usually detected in from day 6 of the infection, and the IgM will disappear by week 12, and that's when the IgG antibodies take over, and we think that it may lurk or exist for 6 to 12 months. There is not much data available to differentiate between the longevity of the antibodies following a natural infection or following a vaccine, so watch the space, but I would still recommend that if we take the booster, the antibodies long laster, and the infection if we get by any chance is milder, so I would definitely encourage to get vaccines. Coming to prevention, I get a lot of these questions. Obviously home remedies or therapies, preventing by wearing masks, social distancing, washing hands, not going for gatherings, not panicking, drinking lukewarm water, ginger, honey, and stuff like that. But other things like, there are some prophylactic antivirals, but those are not yet sanctioned by WHO. And for treatment, there are lots of some antivirals like remdesivir, but there are monoclonal antibodies and steroids, which is the mainstay for the serious condition. Coming to impact, it has got psychosocial impact, economic impact, impact on well-being, impact on advocacy, ethics, and obviously waste. A lot of PPE is there. So I would in nutshell say we should not panic, we should prepare ourselves, and we should be all working together as a team to control this pandemic, and we don't know whether it's coming to an end, but I hope so. Thank you and welcome for questions.
Thank you, Neelam, for this. You have refreshed our knowledge about COVID. The common man has been living through this pandemic of COVID since 2020. I will now request Dr. Dhupelia, who has a vast experience in both rural and urban Queensland, to throw some light on what this common man should do to prevent and protect themselves from the COVID. Dr. Dilip Dhupelia, sir, please.
First of all, I'd like to thank the Indian Medical Association of Queensland for inviting me again to this very important topic on COVID that we are all confronting during this terrible pandemic that we are currently going through. And I would also like to say hello to all the listeners on Australia India Radio, and thank you for having me again on your show. So I've been asked, with my general practice background, of what are some of the options for general practitioners looking after COVID now that Omicron has become so widely spread and that the hospitals are absolutely full and cannot cope anymore with the COVID infection cases and the admissions and the ICUs and the shortage of doctors and nurses. So general practitioners are going to play an extremely valuable role. They already have been heroes during the COVID crisis by stepping up in a time of need. They were originally excluded from the pandemic planning, from the disaster planning, but fortunately our state government has seen sense in realizing the importance of primary care providers and what they actually do on a day-to-day basis. It is GPs that actually know the patients. It is GPs who actually have the trust of patients. And it is GPs who actually know the social and economic circumstances of the patients that they look after. So what's going to happen now? With the hospitals fully overloaded, when somebody gets a positive test for COVID, Health Direct will contact you directly to give you your result. They will also ask you who your GP is and if you have a regular GP. If you have a regular GP, they will contact your regular GP and ask that GP if that GP is prepared to look after you whilst you have COVID and whilst you're going to remain in isolation. If the GP agrees, then the GP will contact you and make arrangements of how the remote care is going to occur. If the GP is unhappy to look after you, or if the patient does not have a regular GP, Health Direct will transfer your care to another GP who is prepared to look after you at home. So this is all going to be done remotely. Patients who have COVID positive are going to be classified into 3 different classifications. Those who are COVID well, and that's going to be about 60% of the patients. Those that have COVID issues, and we need to watch them, in those who have medical conditions, other comorbidities, or immunocompromised state, they will be looked after in a combination between the GPs and the hospitals. And then those who are COVID ill, and that will make about 10% of the people, they will have to be treated in hospitals. So what does the GP have to do when they contact you, and what are some of the things that we need to know? First of all, we will need to know is, are you COVID vaccinated and have you had your booster? Or are you only partially vaccinated? We would need to know whether there are others who are living in your home and are they vaccinated or partially vaccinated. We would need to know whether you are living alone or whether you actually have carers looking after you. We would definitely need to know whether you actually understand what isolation actually requires you to do. And if you don't, this is our job to actually explain that to you. We need to know whether you have a telephone so that we can do telehealth consultations with you on a regular basis. Preferably, we would like to do video conference consultations with you. So we need to understand whether you are technologically savvy, whether you understand how to use technology, whether you have a computer. All of these issues will be determined during our first consultation with you. We would give you advice about how to look after yourself in isolation. It's a very long time to be alone or housebound. We'll give you advice such as what you should eat, the type of calories that you need to keep up, how much fluid you need, what fluids are good for you and what fluids are bad for you. For example, high sugar content drinks that you get in soft drinks. We will also need to know whether you are well enough to look after yourself with cooking, or are there somebody else in the house that can actually do that for you, or do we need to arrange Uber Eats, or do we need to arrange for somebody like Red Cross or Meals on Wheels to deliver food to you? So all these important social aspects are important. We need to know how you're going to exercise. How big is your home? Can you walk up and down stairs to keep yourself busy? What is your mobility? Have you got a garden that you can walk and keep your steps up? Finally, we would need to know what your physical condition is on a regular basis. Can you speak without being breathless? Are you chesty? Do you need any assistance? Have you got any other comorbidities that are worsening? Have you got a fever? What is your pulse rate? What are the signs and symptoms that we should be worried about where you may need admission to hospital? The Primary Health Network will provide you with an oximeter. We need to know what your oxygen saturations are and whether you are maintaining that to above 92. If not, we need to know that that's a sign that your condition is deteriorating. We also need to know things like how fluent you are in your understanding of English. In other words, what culturally and linguistic diagnostics that you actually come from. And we also need to know what your mental health status is and whether you require help from there. So the GP is a very important part of your consultation. speak to your GP, and even if you don't have COVID, make arrangements should you get COVID, how your GP is going to look after you. Thank you.
Thank you, Dr. Dilip. Dr. Alka Kothari, please.
Hello there. Thank you for having me today. I work as an obstetrician and gynecologist, and as you all know, pregnancy is a very special time in people's lives. You know how we advise women to take folic acid? Well, the time is there now to start advising women to also take the COVID vaccine if you're actually planning a pregnancy. If you find out you're pregnant already, then the recommendation at the moment is, with all the safety data around the vaccination, that you could have a Pfizer vaccine or a Moderna vaccine. Either of those are safe in pregnancy. So 2 doses 3 to 6 weeks apart at any time in pregnancy are safe. And this is really, really important, because what you want at the end of the day is a mum that is safe, but also a baby that is safe. And we do know that women who are overweight, who have diabetes or blood pressure, have got increased risk of complications in pregnancy, including COVID. We also know that women who contract COVID during pregnancy have an increased risk, actually up to 5 times, of being admitted to the hospital, and up to 3 times for ending up in the ICU or requiring ventilatory support. We also know that the babies who are born to mothers who have COVID in pregnancy are at an increased risk of being born early. So 1.5 times increased risk of born preterm before 37 weeks, and also increased risk of having a stillbirth or a neonatal death. So my advice to you as an obstetrician and gynecologist is, please consider taking the COVID vaccine. It's also safe for breastfeeding. Thank you very much.
Thank you, Dr. Alka, for enlightening us. May I ask anybody in the audience if they have any question for our panelist?
My name is Arush Khatari, and my question for the doctors is, what is your recommendation regarding a COVID-19 booster vaccine for children aged 5 to 11?
Arush, thank you very much for asking the question. It's a very important question. As you know, in Australia, we have recently started vaccinating 5 to 11-year-old children with the Pfizer vaccination. Currently, the immunity that you develop from 2 shots given 8 weeks apart is giving you tremendous protection. And the World Health Organization, ATAGI, are not recommending booster shots to 5 to 11-year-old injections. So you can breathe a sigh of relief. You do not currently require a 3rd vaccination if you age between 5 and 11. Only those over 18 years of age require booster vaccination. Thanks for your question.
Thank you for asking all these questions. Thank you for attending this program. Namaskar. Thank you all panelists for coming, and thank you to the listeners for giving your time. Thank you.
Thank you very much.
Thank you.